Hey everyone, it's DrRic, and today's unboxing is on Fluvoxamine. Hopefully you can see that. Fluvoxamine is actually a repurposed antidepressant, and the data is strong. In fact, it came out as an observational study in 2020, July of 2020, with France. And here is the paper, and you can look it up on your own. I trust PubMed. That's the National Institute of Health's database. So check it out. Now, even if it's not produced in the United States, they still will cite, especially if it's an editorial, different journals from around the world. And the data that was released in 2020 using the observational study on patients that were admitted in the hospital that happened to be on fluvoxamine showed a better chance of survival and avoiding intubation than people not on fluvoxamine. And it was a very novel approach to considering repurposing another medicine. Those of you who follow me on my YouTube channel, I've done videos on vitamin protocols and ivermectin and vitamin D, other things that back in the day, 2020, there was nothing else available except even before vaccines. So I was throwing out a lot of options aside from just masking and avoidance. And you have to take the information with a grain of salt. And it's not exactly accepted by the CDC, but when there's nothing else available, weighing the risks and benefits, it's still up to you and your physician to figure out, could you benefit from anything else that will increase your survival or improve your statistics to avoid the hospital? And I think there is good data. Now, not that I'm an anti-vaxxer, I do believe in the vaccine. I actually got infected about a year ago, but I decided to get the vaccine as well, and I'm not a zombie, and I lived through it. As far as the booster, my antibodies are still strong, and I suggest that if you're thinking about the booster, get your antibodies checked first, quantitative analysis, and I'll put my link to the video I did before. So with regards to the information, the data, observational is not has randomized controlled, double-blinded, and placebo-controlled, but still, it cannot be ignored. It should be, especially when there's no other options out there, it should be considered. It has to be peer-reviewed eventually, but this is why it's so cool, because the data showed potentially a higher chance of survivability when people were on fluvoxamine. That was just incidental. So fluvoxamine, let's talk about that. Fluvoxamine is a antidepressant. It's commonly used like Paxil, Prozac, Zoloft. I've admitted that I've been placed on Zoloft in the past for my depression, and it does help to change around your serotonin levels, just like fluvoxamine. I have to suggest that when anybody is feeling depressed, definitely when you're feeling suicidal, you have to go to the emergency room. Please do not do this on your own. Don't manipulate your own medicines. Take this information to your doctor and see if it pertains to you. But the idea would be, can we improve chances of survivability? And I think the data is showing yes. So the question is always, well, how does it work? And the mechanism of action was also broken down. This is a good study as far as the systematic review on mechanism of action. It was recently released out of Brazil, the Together trial. And this was robust with information. It has to be, usually what happens is scientific groups will put together analyses and trials, and then they'll gather the data, they'll interpret the data, and they'll present it to a journal. And after fine-tuning it, they'll place it for peer review. After enough doctors review it and governing boards review it, if it's given a thumbs up, it'll be placed in a journal. And that supposedly is the highest success of being accepted by a medical community. Once you're accepted by a medical community and peer-reviewed and given a thumbs up, then all the medical community will start reviewing and accepting that as a protocol. So the Together trial took the information from the observational study and actually applied it in a scientific fashion. It was a small study out of Brazil, just recently released in October of 2021, so please check it out. But it did show that there was efficacy. There was an improvement and survivability, especially with regards to preventing intubation. That's when you have to go to the hospital because your COVID infection gets so bad that you have to be given life support for a short amount of time, or before death. And it showed that the use of fluvoxamine, now this was a different dose than I use. This was 100 milligrams 3 times a day. And that is a bit high. The dose I use is 50 milligrams twice a day. I might as well answer this now because I have a lot of patients that I'm giving this to in my COVID clinic that say, well, I'm not depressed. Am I going to have some weird side effects? And typically, I can see this as a physician and also as a patient when I use the Zoloft, the SSRIs don't work that quick. In fact, they usually take 3 to 4 weeks to work. The usual 10 to 14 days of treatment that's suggested will probably not have it be effective for your depression, which is why you shouldn't use it for depression at these doses for COVID. If you're using any of those medicines I just mentioned, fluvoxamine of all the SSRIs was the only one studied. There are other medicines out there that work kind of the same way. The question would be, does Paxil, Prozac, Zoloft protect you against COVID? That hasn't been studied yet. And believe it or not, there are other medicines that fall into the same category, like amlodipine, which is a calcium channel blocker for high blood pressure. That actually falls into the same category as SSRIs and potentially can work to also support control of cytokine storm in COVID infections. And I guess I just gave you a spoiler. That is how it works. And if you look at the body of the information on the Together trial, you'll see how good the data was collected, how well organized the study was performed, and you can make a decision on your own. But as far as the pathophysiology or mechanism of action, this is the part I like the most because I love pathophysiology. It makes me understand the big disease process on the micronucleus level. So this is a cell wall. It's a lipid layer that protects or separates the inside of the cell from the outside of the cell. So this is a cell wall. This is your ACE2 receptor. And that's typically how COVID gets into your cells, all cells. It's going to be vascular and respiratory, but that's just a schematic. So that's a COVID molecule, a virus, and that's the way it gets into the cell. This is the inner lining of the cell. These two things here are endoplasmic reticula. And those two organelles that are found in most of the cells of your body are responsible for making stuff, making proteins. In the case of COVID, I won't get into too many details because I might be too sciencey, but what happens is this virus gets into the cell, it hijacks your factory, and it makes every cell produce nothing but more viral particles at rapid and at crazy numbers. And that's why most of the mitochondria in your body are exhausted, totally fatigued, because the mitochondria, which are the powerhouses of the body, are just utilized to their extreme. All resources are utilized to produce viral particles. So even if you get your immune system in order and it finds and figures out how to take care of the virus, which most immune systems will learn, especially young people. That's why they fly through infections, or athletes or people with no comorbid conditions. They fly through the infection and come out the other end without any problems. And typically that's because they have a very well functioning and robust immune system. And the immune system learns and it protects and squashes the virus immediately. But for those of us that aren't that gifted, what will happen is while your immune system is working, the virus will continue to replicate and it'll use up all your resources of energy. And that's why until the immune system figures it out, your resources will be exhausted. And most people that are coming off of COVID will be totally exhausted. I have right now a handful of patients that are getting better with regards to their COVID as far as fevers, chills, coughs, colds, shortness of breath, headaches, dizziness, but they're just wiped out. So most of the day, it's a sunny day today, Saturday, but I've told them, oh, bundle up, get outside just for 5 minutes, as long as they're not having fevers or chills, because that shock of being outside in a little bit of cold might put them into a little bit of a storm. But I told them to bundle up and feel the sun on their face just for 5 minutes, because I think it's important to establish day and night. Sleep and wake cycles have to be reestablished because everybody that's got COVID is usually just staying home doing nothing, and sleep and wake is totally screwed up because when you're bored, you sleep all day, you're awake at night because of pain or chills and fever and hot flashes, everything's screwed up. So reestablishing your gut, reestablishing your nutrition, reestablishing your energy, reestablishing what's day, what's night is really important. But getting back to what happens in the cell before all your resources are used up, the cell is being hijacked, and the smooth endoplasmic reticulum, which is right here, these soft bodies that are smooth, no bumps, the smooth endoplasmic reticulum can usually hand off to the rough endoplasmic reticulum, little vacuoles with bumps on them. And that's usually what happens is this guy, SR, sends off to this guy or these guys, ER, and then you produce cytokines. Now, if you have a COVID infection that's wanting to produce a lot of cytokines, but you're on Fluvox or Fluvoxamine, that SSRI, it actually will, without you knowing it, block or slow down the conversion of stuff from SR to ER, and it'll modulate your cytokine storm and cytokine production. So this is awesome. And it's probably a side effect from taking care of depression with an SSRI, but what a great side effect. This was by accident found in France when they happened, I think it was a psychiatry group, they happened to find that their patients that were admitted for COVID, a lot of them that were on Fluvox did better than the ones that were not on Fluvox. And that was observational, but somebody in Brazil decided to actually apply this to methodology and study, and they got results. So again, this is another example of repurposing medicines from other branches of medicine or science to attack a novel virus. Now, we have a lot of vaccines, and I do believe the vaccines work. For those of you who don't believe in vaccines, I understand and I support you, but be careful. I follow the vitamin protocol from the FLCCC. Please check them out. If you're not going to take the vaccine, please use your mask, continue distancing, get your vitamins, and please reduce your comorbid conditions. Get your weight down, get yourself exercising, maintain great sleep, maximize on your vitamins. If you're not sure if you're maximized, get your vitamin levels checked with your doctor. Or come see me. I'll put the link to my virtual office down below. If you do get infected, don't worry, you'll be okay. Most people actually do okay, but either consider getting ivermectin, your vitamin protocols, or asking your doctor for Fluvox. And if you follow the FLCCC's guidelines, it's usually the vitamin protocol first, but if you get infected, ivermectin, and then if you don't respond to ivermectin or you have some reason to not take ivermectin, Fluvox. And then there's other things down the line that also help as substitutes. So check out their website. Do some data search on your own at PubMed. If you used ivermectin or Fluvox, or if you've had any response from your vitamin protocol, put them in the comments down below. Thanks for watching up until this point. If you like this video, don't forget to hit the thumbs up and subscribe for other future videos. Otherwise, I'll see you at the next video.